Thank you, and thanks to my panelists. So a question for Dr. Rachael. The Pan Human Biobank, please explain to the audience what that actually means. Need to switch it on.
Sorry, not a good start there. Yes, the Pan Human Biobank is a collection of samples and data from participants across Abu Dhabi, which will be there to access by researchers, both academic, pharma, industry partners for health-related research. And it's really an asset here to help facilitate drug discovery, early intervention, a wide variety of health-related research.
Thank you. Dr. Gopal, I'm pleased to report that you're one of the early adopters in terms of the collection of samples and data from patients in your department. Can I ask, what motivated you to become involved with the Abu Dhabi Biobank, and what are your aspirations from your involvement in terms of personalised clinical care and research outcomes?
Great question, Paul. Thank you. The fact is that if I look out at our audience right now, 99% of you and your genome is not represented in current medical research. The clinical trials on medications, on devices, all that information has been gained from a very narrow genomic profile in North America and in Europe. And so what my passion is that we need now in the next generation of medicine, therapeutics, which are pharmacogenetically based, to make sure that the human genome is well represented. Otherwise, this systematic bias in the treatment of global populations will continue to persist. So that's why myself has been my passion. I've recruited some specific specialists, Dr. Kadura from Canada as well, in collaboration with the excellent work that you're doing to make sure that 99% of the human genome and the human population are represented in the next generation of medicine.
Thank you, Dr. Gopal. Dr. Saha, representing the DOH, thank you for stepping in at short notice. So, from the regulator and funders' perspective, what are your aspirations for the Abu Dhabi Biobank in terms of its research mission?
First of all, thank you very much for having me. As Dr. Gopal emphasized, we recognize that our population is very underrepresented when it comes to genomic studies that have been conducted globally. And so what we're aiming to do is to gain insight into what makes our population unique and ensuring that we are tailoring prevention, diagnosis, treatment to our individual profile. This is DOH's ambition as we move away from a one-size-fits-all to a more tailored approach when it comes to care for our patients. When it comes to research, we're making sure and we're aiming to ensure that there's a feedback mechanism. So as we implement new programs, we're also ensuring that there's a feedback mechanism to ensure that we are truly gaining benefits and insights into whether or not these implementation practices are working and ensuring that we are giving the best care when it comes to our patients.
Thank you. Another question for Dr. Rachael. So the Pan Human Biobank broadly falls into two categories. There's the disease cohorts, and then there's the healthy population, the longitudinal prospective component. Perhaps you can talk to that and the challenges and pros and cons of both approaches.
Yeah, sure. So the longitudinal population is those individuals who are notionally healthy, and you follow them through their life, and over time they develop disease, and you can then make links back to what was the cause of disease, link it to environmental data, health record data, lifestyle data, and other factors that might influence their disease. But what happens with that is that takes several years before you can actually gain any findings from it that can have a clinical impact or an impact in the healthcare sector. The disease subcohorts are what we call nested case control subgroups, and they're really important. What they allow is they allow for diseased individuals, so chronic disease that's highest burden in Abu Dhabi, things like cardiovascular disease, diabetes, oncology, and other diseases as well. And that allows you to literally recontact those individuals or focus research efforts directly on disease and controls match to make a direct impact sooner rather than wait the several years that it would take with a longitudinal element. What's also really good about Abu Dhabi is the infrastructure here that's in the country in terms of electronic health medical records is actually really extensive. We do lots of environmental monitoring. There's lots of phenotypic data that's available, other initiatives led by the DOH, EGP and various others as well that are already existing here. So it allows you to do a retrospective and a prospective longitudinal data set, which is really valuable.
Thank you, Dr. Rachael. Dr. Gopal, the biobank's success relies on the goodwill of patients to participate in research, and it requires large numbers of patients to participate in research. In your clinic and in your work, how would you convey the mission of the Abu Dhabi Biobank to potential participants, to get their buy-in?
Thanks, Paul. I mean, the UAE is the meeting place of the world, so I think we're unique in the sense of the phenotypic and genetic diversity that we're going to be able to get here is probably unavailable in just about any other place in the world. So again, going back to my feeling that we really need to have the world's genome represented in the next phase. Now, we have a population that we deal with here, both citizens and residents of the Emirates, that are this is a very giving society. And them being presented with the opportunity to help other members of their society, to help society in general, I think is a message that comes right down from the leadership of this country and is really lived by the people of the country. So we've really never had any issue recruiting people for research when even at their own discomfort, if they know they're trying to contribute to a higher cause. So I'm very confident, very rapidly, the cooperation between the DOH, the Pan Human, and our own infrastructure will build the largest biobank and most diverse biobank in the world. So again, I'm very excited.
Thank you. I think your point resonates with the uptake in the EGP, where 80% of the population have volunteered, and that number continues to grow. It's fantastic. Dr. Rachael, the prospective component of the Pan Human Biobank is essentially hypothesis-free. You're collecting lots of data from various sources: environmental, socioeconomic, occupational, health, genomic. On large numbers of people and following them with an unknown research question. Can you just kind of talk to the concept of a prospective biobank in the fact that it enters into the domain without a particular research question?
Yeah, that's the beauty really of a prospective cohort biobank. What happens, as Paul said there, you follow those individuals notionally healthy at the time of joining, perhaps, through their lives, making linkage back to electronic medical records for phenotypic data, clinical data, other records, environmental, lifestyle, diet-related, exercise, all those different factors. And it's collected with the fact that it can be used for any health-related research. And that's the greatest value of it, really. You're not targeting one disease or one cause. It's there and usable for all areas of disease, both acute, chronic, as we've touched on, cardiovascular, oncology, mental health, other aspects as well.
Thank you. A question for Dr. Gopal. So there's various organisations have been established to network biobanks, particularly disease biobanks. So Abu Dhabi is keen to participate in those federated networks. I appreciate previously you were involved in a biobank in Canada. I'd welcome your thoughts on the benefits of collaboration with other biobanks, that the sample size is increased and the data depth is increased.
Of course, Paul. I mean, the modern research world in any field is about collaboration. Us developing new knowledge, sharing that knowledge, getting new knowledge, incorporating that knowledge. My experience has been with Canada, but we have recruits. I mean, we have a massive biobank in the Cleveland Clinic, Ohio. We also have access to their quantum computer, which is the only privately held quantum computer in the world. So, because one aspect of having the luxury of so much data is the burden of having so much data and the computational power to understand that. And obviously, we could have an entire conversation just how AI is going to transform our understanding. We know what we don't know. We know what we know what we know. Sorry, we know what we don't know right now. But also the beauty of these collaboration and quantum computing is to be able to explore the unknowns that we don't know and open up new avenues that we can't even imagine right now. So collaboration, of course, is key.
Thank you. Saha, the DOH has had the foresight to sponsor some very significant initiatives, EGP, Malafi, the environmental monitoring, and now the TRE. So to bring these large data sets together into a central repository to allow various utilities, but principally research. To make best use of the data, you need to invite world-leading experts in to use it wherever they reside. Can you talk to the DOH's thoughts on how to best capitalize on this enormous data set we're collectively building?
So when the Emirati Genome Program was launched, we always kept at the forefront of our minds of how this data would be utilized, ensuring that we have robust policies and frameworks established so that accessing genomic data, which is considered highly sensitive, is safeguarded. So this has been through the implementation of federal laws as well as local policies as well. So we're putting patients' rights at the forefront while also ensuring that we're providing the tools to researchers, to innovators, to our industry partners that they would be able to access the data and make meaningful insights out of them. Stressing on the importance of the data that we have. It's a very underrepresented population. We have collected samples not only from the Emirati population, but as part of the 100K for Humanity, we've also collected 100,000 samples from our expat population. Keeping in mind that we know majority of what we know is based off of European ancestry studies. So we really want to ensure that we are providing as much data as we can to these researchers through the trusted research environment so that they could do their research in a very secure way, in a secure environment.
Thank you. Something of a mundane question, but critical to the biobank success, and perhaps one for Dr. Rachael, is the consent that the individuals that participate voluntarily sign that may place restrictions on how the data can be used in research and how the people may be contacted in the future for suitable research studies. So I just welcome your thoughts on the importance of getting consent right.
Yeah, it's the most important component, isn't it, really? So when we look at consent, particularly in biobanking consent, which is quite unique actually, because what you're asking a participant to do is to allow future uses that may not have been disclosed yet for their samples and their data for the good of health-related research. So actually, from a participant point of view, you're asking a lot. What we can do is biobanking globally is quite well established, and some of the uses of that biobanking data are also quite well established. So we can kind of say we're going to be using it for genomics, we're going to be doing proteomics on it, we're going to be doing metabolomics, and we want to link to your clinical health-related data in order to drive healthcare-related research in Abu Dhabi. And that's really key. There's some fundamental bits about biobanking consent which make it unique compared to other studies. So one major factor is recontact, probably one of the most important. And it's something that's often neglected by other biobanks as well. So that important concept where you want to be able to stratify a population, if you like. So recontact and recall those individuals maybe by a certain phenotype or a genotype to do focused clinical trials or further research. And that's really, really key. And the biobank consent that we have in place really facilitates that and allows that. And that's going to be a driving force in the future in Abu Dhabi.
Thank you, Dr. Rachael. Final question for Dr. Gopal. If we take a 5 to 10 year horizon working with yourselves at Cleveland Clinic, what would success look like? What would you like to see the biobank achieve through our collective efforts?
Well, I think in the scheme of time, 5 to 10 years, 5 years, we're going to have a well-functioning, high-volume, lab worked out a lot of the kinks, collaborating, and a fundamental high-quality, high-impact research coming out of there. I think at the 5-year mark, I'd love to be able to be in a position to say we have phase 2 trials, at least safety trials out from some therapeutics that we've been able to deliver. And also a very healthy, established relationship with industry partners around the world that are accessing the biobank, because there is we don't have to be responsible for each and every development, nor should we be, nor are we capable of. But to be able to have a strong partnership, be recognized as world leaders in proteomics, genomics, and having established world-class partnerships, I think that would be pretty good for 5 years. At the end of 10 years, I'd love to see therapeutics that have been developed, and by that time, I think it'd be realistic to look at in-human trials.
Thank you. I think that's an excellent answer and an excellent summary of, in my view, of what success looks like, in that we build a resource that's attractive to the research industry globally, and it can be utilized for developments, both in therapy, diagnostics, and prevention. I think we're on track to do that. Thank you. Thank you to my panelists. We'll take questions. We have a couple of minutes left. Somebody with a microphone, other than me?
Hi, everyone. Thank you for the really enriching discussion. I have to say, personally, I'm very excited when I saw the Pan Human.
Hold it closer to your mouth.
Yeah, I was just saying hi to everybody, and thank you for the insightful discussion. I'm personally very excited about the Pan Human Biobank, and I come from a background of biorepository, so my work was mainly about collecting samples from humans for research. So I think this is a great area for the UAE to go into, because you have all the data that most biobanks will not have. And the follow-up and the longitudinal collections will enrich any research that's going to happen after. My question is on the how. I know from experience that researchers want different kind of samples, preserved samples, fresh samples. So how is a biobank that's prospective going to fulfill these requirements from researchers?
Perhaps for you, Dr. Rachael.
Yeah, thank you. Good question. So standardise operating procedures, obviously fundamental to this. Abu Dhabi is actually quite well advanced. We've got very good advanced healthcare ecosystem here. And actually, from a biobanking perspective, that's a nice platform to start with. Collecting samples in a standardized format is nothing new here, and I think we can build on that. So the idea behind collecting these samples is you collect samples that can be used for all uses. So you have to think about that in terms of the collection protocols, the preservatives within those samples, how are you going to store those samples that make sure that you've got that usability in the future. And that's really key. So the biobank setup with very sort of standardized, high throughput processes that will be well piloted before a formalized collection happens as well. And we obviously have multiple different storage types, automation, and all those key. We're also very, very big on our accreditations, and directly behind you is Heather, who's our quality manager at the biobank. And there's a framework that we're going to operate to in coordination with DOH as well. So we're looking at getting accreditations to obviously the international standards as well that are in place to help give that trust and transparency in what we're doing.
Thank you.
Thank you.
Thank you. We're officially out of time, but if there are any more questions, we'll be in the audience. Thank you. Thank you to my panelists.